I'm JC.
And today we're going to tell you all about this amazing drug called
Haloperidol.
All right, so first we're going to get started with what's all about.
Okay, haloperidol is an antipsychotic drug that blocks dopamine. It is mainly used for schizophrenic patients and Tourette's. So haloperidol can be given both PO and IM. With PO, it can be given with tablets or a solution. It is given either anywhere from 0.5 milligrams to 2 milligrams, and it's given twice a day or 3 times a day. With our IM, it's given in the dose of 2 to 5 milligrams. The max that they can have in a day is 20 milligrams. It's given every 4 to 8 hours. Now, if we're using it for prolonged therapy, it's given in the dose of 50 to 200 milligrams IM every 4 weeks. So our therapeutic effects would be it's going to reduce aggression and it's going to decrease those negative thoughts and hallucinations. Now also when storing these medications, whether PO or IM, they need to be stored away from sunlight, and a slight yellowing in either the oral solution or the IM is normal, but if it turns a dark yellow color, please let the doctor know.
All right, so that's what it is all about, all right?
Okay, since we know all about haloperidol or Haldol, let's tell you a brief overview of the dangers you will be seeing with our medication. So some dangers you will be featuring would be NMS or neuroleptic malignant syndrome. Some seizures will get you a little bit spicy here and there, some prolonged QT, some torsades de pointes, and some leukopenia, all right? Aren't those just amazing points of view? All right, we don't want to use these with opioids because it will lower our respiratories mainly and have some sedacious effect, which can lead you to death. Ain't that a great factor for us? We want to avoid this with dementia patients, mainly because they're near dying, so we don't want them to die more with more medications. No smoking because it can lower the amount of concentration, and alcohol increasing CNS depressants.
As Haldol is a first-generation antipsychotic drug, we want to make sure to be wary of any signs of EPS or extrapyramidal syndromes, which are acute dystonia, pseudoparkinsonism, akathisia, and tardive dyskinesia. We want to stop it immediately if they're showing these symptoms and add a benztropine.
All right, so let's go continue moving forward. And what else we need to know for nursing considerations? As a nurse, this is what we need to look out for. We want to look for signs and symptoms of NMS. So what that's going to look like is there's going to be a mental status change, it's muscle rigidity, hyperthermia, and an autonomic disturbance. It's rare but fatal, but it can happen. And we want to always monitor ECGs because of those prolonged QT intervals. We don't want to give this to dementia patients because it can increase their risk for death mainly. And we don't want to withdraw it abruptly, as always with any medications. All right?
Okay, some of our teachings. We're going to avoid operating heavy machinery due to dizziness. And as always, no alcohol when taking this medication. We want you to report adverse reactions such as jaundice, gynecomastia, and blurred vision. And to relieve, this can cause dry mouth, so to relieve that dry mouth, you can suck on some hard candy or anything like that just to keep the inside of your mouth wet.
Okay, and that's all you need to know. Go check out our medication, Haldol. Go Haldol.